testing for neurological diagnosis. The purpose of the orthopedic testing is to reproduce the patient's complaint in a specific way to help narrow down the diagnosis. We're going to test with our meet sign, which is essentially neck flexion. Our positive sign on this test will be electric shock-like sensations into the extremities, which indicates spinal cord degeneration or spinal cord injury. Brudzinski's sign, a test for meningeal irritation. The positive sign is when the neck is flexed, we get involuntary flexion of the knees. It indicates meningeal irritation, like meningitis. Koenig's sign, the other test for meningeal irritation or meningitis. We flex the patient's hip to 90 degrees, the knee to 90 degrees, and then extend the knee. The stretching from the sciatic nerve into the lumbar plexus into the lower end of the spinal cord refers pain going up into the neck. So our positive sign is neck pain, indicating meningeal irritation or meningitis. Soto-Hall test is a non-specific test for the general integrity of the cervical spine. When we have a positive on Soto-Hall test, it's not going to tell us what is wrong with the cervical spine. It'll tell us that something is wrong with the cervical spine. The main value in Soto-Hall test is when it's negative, you know that the structural integrity of the cervical spine is intact. The test is going to involve neck flexion, but our positive sign is neck pain. The patient will be inclined to resist neck flexion by flexing the trunk. So we need to stabilize the patient so the patient can't flex the trunk and bring the shoulders off the table. Can you cross your arms like this? Stabilize and bring the neck into flexion. Our positive sign is cervical pain, possibly down to the level of T2, and it indicates general loss of structural integrity in the cervical spine. Salva maneuver is a test to reveal the presence of a space-occupying lesion, such as an osteophyte, a disc bulge, or spinal stenosis. We ask the patient to take a deep breath in and bear down as though straining with a difficult bowel movement. This is going to increase the intrathecal pressure and exacerbate compression on the nerve root, reproducing radiating pain. So our positive sign is radiating pain away from the site of lesion, which will indicate a space-occupying lesion. Can you take a deep breath and bear down as though straining with a difficult bowel movement? Our next exams are for foraminal encroachment syndromes. The first is cervical foraminal compression test. We are going to press straight down on the patient's head, looking to compress the foramen, encroach the IVF, and put any pressure on the nerve root. If the test is negative, we want to make the test more sensitive with head rotation, further compressing the foramen on the side of head rotation. Once again, our positive sign is local cervical pain would indicate the presence of foraminal compression, foraminal encroachment, or facet pathology without nerve root compression. And in the presence of a radicular component, we would have foraminal encroachment, facet pathology with nerve root compression. Jackson's compression. We're going to tilt the patient's head toward the side, encroaching the facets further on the side of lateral flexion. We want to compress down and in. Our vectors are going to be moving this way and straight down on top of the facets. Once again, our positive sign is We can have local cervical pain indicating the presence of foraminal encroachment or facet pathology without nerve root compression, or the presence of radicular pain indicating foraminal encroachment or facet pathology with nerve root compression. Maximal foraminal compression. We're going to passively put the patient's head into this position, rotated, laterally flexed, and extended. This maximally compresses the facets on the side being tested. So again, our positive sign is local cervical pain indicating foraminal encroachment or facet pathology without nerve root compression, or radicular pain, which would indicate foraminal encroachment or facet pathology with nerve root compression. For cervical distraction test, we're going to lift up on the patient's head from the mastoid processes. This test should, in the presence of a foraminal encroachment syndrome, relieve pain by relieving pressure on the facets. We want to get behind the patient's ears with this aspect of the hand underneath the mastoids and lift straight up. Our positive sign will be decreased or absence of pain, which indicates a foraminal encroachment syndrome with or without nerve root compression based on the presence or absence of radicular signs. Cody's test, the patient is already experiencing radiating pain from the neck down into the arm. So we ask the patient, can you put your affected arm, put the palm of your hand on top of your head. Positive sign here is decreased pain going into the arm, indicating traction of the brachial plexus by the suprascapular nerve. This position relaxes that traction from the suprascapular nerve, relaxes the traction on the brachial plexus, and reduces the pain.